Deepa Chowdary, and we have this theme today, helping the helpless and needy, India's war against COVID-19. To grace the occasion, I would like to welcome all our guest speakers for this evening. We have Dr. Jayashree Kadambi. She is a special educator from USA. Welcome, Dr. Kadambi. We have Dr. Shafiur Rahman. He is founder of Global Human Rights Peace Foundation. Welcome, Dr. Rahman. We also have Dr. Rajalaxmi Alan from UK. She is CEO, Millionaire Fly Emi Academy. Welcome, Dr. Ellen. And we have Ms. Farhana Haque. She is a Ph.D. Research Fellow from Brunei. Thank you so much for coming on this platform and for a fruitful discussion.
Oh, yes. See, I think every participant joined now. Let us start the session. Deepa Chowdary, ma'am, sir, everybody, my dear friends, a great namaskar from India. Good evening, my dear friends all over the world. I'm Dr. Regunath Parakkal. Incidentally, I'm a professor and a psychologist. I do a lot of counseling works all over India. I am also connected with NCPCR, National Child Care Protection Council, and I do a lot of social work all over the world. I'm attached with so many platforms all over the world. Anyway, I'm basically a counseling psychologist, and moreover, I want to tell you I'm a positive psychologist. So whatever I view, that will be viewing only through positiveness. In the COVID situation also, I want to communicate certain positive things. First of all, I want to tell you, see, every illness start or the spelling of the illness start with, sir, you will agree that with I. Am I right, sir? Sir, the question is towards you. Every illness starts with I. Am I right, sir? The spelling
yes,
of...
Sir.
Yeah, you will agree.
Yes, sir.
So, but India is facing such a kind of situation with WE, not I. We are combined together. Instead of the I, we are attacking the COVID situation with WE. So definitely the wellness will be there. You can understand the spelling of illness start with I, whereas we want to communicate the positive aspect as a psychologist that everything we are dealing, especially Deepa ma'am, you will agree that it is with we. We are combined together. Our government is together with us, right? Psychologists are there. Our doctors are serving like anything all over the India. And definitely as a positive psychologist, I want to tell you, we will overcome the situation. Of course, there are certain problems. Yes, there are certain problems. See, certain problems mean, Deepa Chowdary ma'am, you will agree with that. I want to tell you as a positive psychologist, 4 Fs. And finally, I want to come to the 2F. The first thing now India is facing is nothing but the fear. Am I right? So we are
yes, sir.
facing the fear and we are flying away from the fear. So we are not facing the fear. We are not facing the fear. So definitely with all our combined efforts with the central government, with the state government and all other health workers, with all the help of the positive psychologists, we will be facing the problem. So definitely within 2 to 3 months, we will be able to finish the problem. You know, Deepa ma'am, you will agree that once you get a cobra bite, right? The poison will enter into your body. Am I right? But because of not only
yes,
the poison, the patient is going to die. I think you will agree with me, ma'am. It is not because of the poison alone the patient is dying. It is because of the fear factors that the cobra bite is so strong that will create so many problems. So that is going to, end my rather living or rather something like that under the fear factor is really developing. Whereas we are educating thoroughly to face the problem. And finally, we will see that, yes, we will be finishing the problem. See the case of Kerala state. Yes, because of the concentration of the, you can understand the concentration of the population is very high in Kerala. So because of the COVID situation, you can understand that because of that concentration is high, the COVID situation is also worsening, but we are able to face the situation and the death rate is comparatively very low, right? The death rate is comparatively very low. So I want to tell you the proper identification of the problem, facing the problem, definitely will finish the problem. Yes, we will be able to finish the problem shortly. The herd immunity is going to come for almost a few percentage of Indians. And we are working thoroughly on the vaccine part. Vaccine part. And you can understand, we are proud to say that, see, our Indian vaccine manufacturers supplied the vaccine all over the world. I think it's a very, acceptable fact by the other countries that we have helped, the other people also. And total concentration is going to come as far as the population of India is concerned. Serum Institute or whatever the people who are manufacturing, including the Bharat Serum, etc., is going to manufacture a lot of vaccine. And in addition to that, the Russian vaccine is going to come, and Pfizer vaccine is also going to come. Okay, definitely we will be able to overcome this situation. I'm a psychologist. I want to give the positive aspects all over India, all over the world, because Deepa ma'am, I want to ask you another interesting question. Whether this is the first pandemic we faced in India or in the world, more than this corona death, we face a lot of other pandemic disease. Am I right? We are able to
Agreed.
overcome such a kind of situation. And there was no much medical development. So if we can overcome such a kind of situation, definitely as a psychologist, as a positive psychologist, I want to we will be able to overcome such a kind of situation. And finally, the victory is going to be ours. As I said, in the case of cobra death, right, cobra bite death, because of not the poison the concerned person is dying, but because of the shock or because of the thoughts about that. Definitely, we are going to change the entire thoughts, and we are going to work about the mental health also in the pandemic situation. Of course, there are confusions. I have to admit that, no doubt about that. Of course, there are so many confusions about that. But one thing I want to tell you, all my Indian friends, that we are taking care of our mobile by attaching a screen, a saver or something. We are taking care of that mobile like anything. And when it is coming to the point of two-wheeler, we are not taking care of our head much because we are not wearing the helmet. Whereas along with the corona death, if you are taking exactly the statistics of death, because of the accident, so many deaths are also happening. It is almost equivalent to corona death earlier. When it is now, it is higher, no doubt about that. So the thing is, yes, the awareness part should be there. Now we started, really wearing not single mask. We started wearing two masks. Am I right, Deepa ma'am? We started wearing two masks so that almost 95% protection, or at least 80 to 95% of protection is there. If it is, of course, N95 mask, no doubt about that. Yes, naturally, more protection also will be there. And of course, I don't want to talk about the sanitation part and other things, but I want to tell you another interesting thing. See, along with the droplets, when it is entering into your nose, naturally you are, getting the corona. So another thing, there is a possibility infection is when you are touching a surface or when your hands are exposed to the droplets. Naturally, when you are touching your nose, there is a possibility of entering of the droplets. Deepa ma'am, you will agree that. So if you are a right-hander, Deepa ma'am, what you are going to do? That's my question. I want to ask my sister what is you are going to do. Because I want to give you an interesting thing, because this session should be always to be interactive. That's why just if you're a right-hander, to avoid touching your nose, what you are going to do? Touching your mouth, what you are going to do? I'll give you an interesting thing. Okay, ma'am, do one thing when you are, using the handle or rather the lift or something. We are always using what? The right hand, am I right, ma'am? So if you're a right-hander, you have got the tendency of touching your nose with your right-hander. So when you are going outside, naturally you use your left hand much. And after coming back to your home, immediately you have washed your hand, or you sanitize your hand. This is what I want to tell you. Anyway, we are going to face this problem, because this is not the first problem the entire world or the India faced. We are really able to overcome all this problem. That's why I want to repeat again, not fly away from the problem and get the fear, but face the problem and finish the problem. Yes, we can do it. And to support all the adolescents or the youngsters, the government of India, with the help of NCPCR, National Child Care Protection. I am also one of the person who is doing counseling all over, India. I see we are all trained from NIMHANS, Bangalore. That is one of the, famous institute. I can get you the number also. See, when we are communicating, so naturally you can communicate the number also, so that it is a free toll member. Then free toll number. So when you are youngsters, when your adolescents are having stress, you can call this free toll number. Ma'am, you can also, chat, get the number in the chat box. It is a free number, 1-800-121-2830. I'll repeat, ma'am, 1-800-121-2830. So if you are calling, definitely you will get the concerned person with, concerned choice of your language. It may be Hindi, it may be Tamil, it may be Malayalam, it may be English also. So yes, 1-800-121-2830. So it's a free toll number, ma'am. You will get psychologists there. And as far as a psychologist, I want to tell you, all the psychological and psychiatrical problems start with stress. Iba ma'am, you will agree, no? All the psychologists and psychiatrists will start with a stress. In order to avoid the stress, you can call that particular number. Yes, once again, I will repeat, we Indian peoples will be able to face this problem. We are going to face the problem, and we are going to finish the problem. Of course, see, second time pandemic situation can come, but we will be overcoming this kind of situation with herd immunity, as well as our vaccination is going to be controlled. And we are going to have a lot of other aspects. Now, Kerala is going for a total 9 to 10 days lockdown. So we are all taking the message. Yes, definitely, we have to follow the experts' language in this particular. In order to conclude this session, Devama, I want to tell you, most of our media, right, including newspaper, if you are reading, you get frightened. Try to avoid such a kind of news. And along with that, no, try to avoid such a kind of, no. When you are opening any media, you are getting a negative aspects. But no media is highlighting how many people overcome from the situation of the corona, etc. So it is high time you go through only the positive news, feed the positive things in your mind, and you will be able to face the entire problem. With that, Deepa ma'am, I got a session with IMHR Bangalore. I'm passing, I'm rather stopping it. I'm really thankful to the organizations and my friend Deepa ma'am, everybody, my dear friends, and definitely with a threatening that we will meet in some other platform. Nice of you. Jai Hind. Jai Hind.
Thank you so much, Professor Regunath Parakkal. That was really insightful and would help us a lot. Also, the helpline number that you have suggested, God forbid we don't get to use that, but still, in case of circumstances, that was
You can even
indeed
give my number,
a
ma'am.
great
No
help that you
issue.
provided.
Yeah, ma'am. Even see if they have got any personal problem, they can have a, personal chat with me. No fees is charged. Entirely, that fees will be free also. You can also always give
Wow.
because I want to contribute something
That
to
is
the society.
absolutely.
Also,
Thank you so much. So you can provide your number in the chat box if you don't mind.
okay, I'll
Any of the
provide it.
attendees
I'll provide
in
it
case.
now itself. I will provide it. Right.
Sure, that would be really nice. Thank you so much for your insights, Professor Regunath Parakkal. And it was an honor of ours to have you at this screen sharing session with us. Thank you so much. Now, may I request our next speaker, Mr. Dr. Shafiur Rahman. He is the founder of Global Human Rights Peace Foundation to share his insights and his views on our current topic today, helping the helpless and the needy, India's war against COVID-19. Over to you, please.
Hello.
Yes, Dr. Rahman, you are audible.
Good evening, everybody. You have heard Dr. Regunath Parakkal insights also. He was right that there is a fear in the people. But what I say that the fear should be there. To face the challenges of pandemic, the fear has to be there. If fear is not there, neither you will wear mask, neither you will sanitize yourself, and you will roam around spreading the virus. Now coming to this virus, what exactly people are doing? Right. Lockdown, what the government is trying to do, lockdown, it's a safer side. It's a safer side. One has to follow that. To save, because we are seeing challenges in Hyderabad. Every day there are thousands of cases are coming up. And government is not equipped anywhere, either in Kerala, either in Delhi, either in Telangana, wherever we talk about, government is not equipped to take care of this victims. See, any of the city, any of the state, you have 2 government hospital or 3 government hospital who is catering COVID, right? If you take ICU beds in all the hospital, it's hardly into hundreds, but the cases are coming in thousands. And for the common people, government hospital is also not reachable, and private is ruled out because private, it's a highly chargeable aspect. So common people can't enter into the government private hospital. So now, if you see that if we have to save our life, we have to be very safe and isolate ourselves. Youngsters, yes, youngsters has to come forward with the safety measures to help the people. See, today every family is running for oxygen. Every family is running for concentrators.
Dr. Rahman, are you there?
Yeah. Just a minute. It got disconnected.
We can hear you, but we can't see you. Yes, we can see you as well.
Yeah. So the thing is that now there is a challenge everywhere. There is a challenge everywhere. Even the youngsters has to come forward to support the elderly people, right? See, there are a lot of groups which has already been established on the social platform for oxygen numbers, for concentrators, for ambulance, but this is all like, it's all like fake information. If you receive a number for oxygen provider, you call, it is either switch off or either it is not functioning at all. So there is a problem. So what I say that this pandemic will continue. It will not stop. See, now we are in the second wave, and it has been already announced that by October, the third wave will take place. And this third wave will start infecting below 18 years of age. See, government is aware. That's the reason government has started giving vaccination to above 18 also. Because government is aware that the pandemic is going to hit all the areas, all the ages, irrespective of child, youngsters, the one who is having immunity or the one who is not having immunity and all. And what I suggest is that please, we should not follow the videos which are getting circulated on the social platform, because everyone has their own opinion and all. And if you keep on following all the videos and all, you will be in trouble. You will not come out with the pandemic. You will be in trouble. Like today only, I've got a video that one lady has messaged that 4 drops of lime juice, if you put in the nostril, nose, right, the entire infection which is there in the lungs will come out. So this is not fair enough, this kind of videos to be circulated on the WhatsApp and all. That's the reason the government has also announced that nothing has to be uploaded on social media about COVID. Any kind of medication or any kind of information and all. Because the challenges are there. See, government are not ready. With to handle the pandemic. See, today the thousands are coming. What suppose tomorrow the lakhs get started? So there is a big challenge, and we have to accept that. Now we blame on the government. I do agree, but yes, government has their own parameters to look after. Right? Overnight they can't do. Yes, but there is a time. Though the third wave is already announced that October it will hit India, third wave. Right. Now we are talking about droplets and all. Now droplets have gone. There is nothing droplets we are talking about. Now the virus is in air. It is in air. It stays in the air for 3 hours and all. And those who ever get hello.
Sir,
Hello.
it is audible.
It's audible now. It's audible, ma'am.
Yes.
Okay. Now, what I was saying about the COVID, the virus earlier was into the droplet form, right? Now the droplet phase has already gone. Now the virus is in the form of air. It is in the air. Earlier it was 200 microns, which was coming out from the droplets. Now it is 20 microns. 20 microns, very tiny viruses, which can easily enter to your nostril and to your lungs. Right? See, coming people, there are lot of cases. People are getting maimed, and it has been reported that he has died from the virus and all this thing. But I can bring to the notice also, it's not only for the virus. They have multiple complications earlier. Multiple complications like organ failures and all. Lot of people have diabetic. Diabetic means kidney failure. If it is more serious, diabetic 3, diabetic 4 and all, his kidney will be failed, most probably. Right? Even the cardiac also the same thing. People are dying with the cardiac and all. Today, worldwide, if you see, I remember because I am from medical tourism also, lakhs of people used to travel for medical tourism to India for various complications. Neuro problem, cardio problem, cancer. Cancer is one major area in India, right? People have forgot that. With this virus, people have forgot that. But if you see that the people, those in this pandemic has not visited the clinics, hospital because of the lockdown or because of doctors are not available and all this thing, they are into major trouble. They are getting killed by their this organ failure also, right? But everything is going on COVID, right? Because now this is the present COVID which is going on, and hospital also enjoy. Yes, people died with the COVID and all. But the challenge is that COVID, people dying with the COVID, neither the body is given to the family members, right? Especially if we talk about Muslims. We talk about Muslims, right? Muslims has a ritual of giving a bath. Everyone gives a bath after the death. Everyone gives a bath, right? But now here the challenge is that the body is not given. The body is straight away taken from the hospital and cremated directly, right? In certain scenario, I've seen that even Muslims, Christians, whoever are there, they have been burnt. They have been burnt in a mass burning. They have been cremated while burning it, right? So it's a very pathetic situation. Pathetic situation. We should understand. We should understand. Life is once only, right? Life is gone. Nothing will come back. Nothing will come back. So what I suggest that we should be very careful, and especially we should take care of elderly at our home. Elderly at our home, because youngsters moving out in the city, coming back, they are the carriers. They are the carriers of virus, and which they bring back to the home and given back to their elderly, right? And it's a very easily the virus gets transmitted. It's a thankful of God that we didn't got any community transmission. Community transmission is one wave which is left, right? Now the third wave what will be the third wave? God only knows. But yes, the community transmission is the final wave in this pandemic, right? If people have not watched a movie, I'll just tell the name of the movie. It's a Contagion. Contagion. Yeah. If you see that movie, that is the community virus. That is a virus which is there. And WHO was aware, CDC was aware, everyone was aware that what the virus will play like, right? So that community transmission is a very dangerous, where even people going out is very different. People coming out from the room also, it will be a problem. So we have to be very careful, very careful. And I tell again that the youngsters should come forward. They are there, or everyone is there on the social platform, right? We have to identify the right people helping out for the oxygen concentrators, right? And if you see that there was a remdesivir injection problem, right? People started doing black also. 5,400 rupees injection was black for 38 to 50,000 rupees one vial, right? Where even in Apollo it was 36,000 rupees for 6 vials in the first phase. Even though it was in black only, but still it was there. But yes, people know this injection based on the social media platform. You ask any of the person in India, which is the injection given, they'll say that remdesivir. They don't know the terminology, they don't know what is the useful of that injection and all. Yes, but they say that remdesivir. Arey boss, we are not getting remdesivir and all. But it is very clear that that remdesivir never treats a patient. It is only for the first phase. First means what we say that CORAD 1 or CORAD 2, the initial stage where the patient is affected with the COVID. Only the remdesivir work on that only. People are not aware. That's the reason we say that youngsters, every house there is a BSc student. If you agree, everywhere there will be in the family, there will be a BSc science student will be there. So it is their responsibility to understand what is the injection all about and all. See, we study. See, from in medical tourism, I am there for past 8 years. I do treatment, get international patient in Hyderabad, Bombay, Bangalore, Chennai for the treatments and all, right? But yes, what we do is that we never just bring the patient and dump them into the hospital. We are the mediator between the doctor and the patient, because patient doesn't understand the medical terminology, right? Whatever the doctor say, he has to accept. Because as we have called them to India for the treatment, it is our responsibility that we should interfere and understand whether the treatment is going perfectly or not. Because whenever there is an opportunity, everyone is taken on the right. Either it's a medical or any field, people are taken on the right. So this is what, but yes, COVID is concerned, and I request everyone, please go for vaccination. Though vaccination doesn't save the lives, doesn't save the lives. Yes, some part it plays its role. It will not affect you much the way it is getting affected. The first dose, obviously, you will have side effects with the fever, body pain, and all this thing. 3-4 days you have to manage. If you have to manage the COVID, you have to manage this pain. So I request everyone to go for vaccination, either Covaxin or Covishield. Don't wait what the government will call you, will give you the vaccine. Vaccine is available everywhere. Everywhere. People have fear. With the after vaccine also people will die. Yes, virus will come. Even after you take the vaccine, the virus will come. It is not that it is ruled out. The virus will come. See, it's not that if you're wearing helmet going on 100 speed on two-wheeler, right, you will not break your head. Your head will break. So by default, you are in trouble anyways. But still, we say that safety is more important. Safety is more important.
Thank you so much, Dr. Rahman, and very nicely said about this example of helmet. So even I was told, I used to be very curious about, so what will happen if I take the vaccine? So that does that mean that COVID will not affect me? Then was like, no, you might get COVID. And we are hearing nowadays, in my acquaintance, I'm hearing the cases that despite of getting this COVID vaccine administered, still people suffered from COVID-19. They still got it. But the condition was that it will not get that fatal. We would not have a casualty if we get that vaccine. So that was the thing. And now you rightly connected it with the helmet thing. Now it is very clear in my head that accident might happen, but the head will still not be crushed because we have that helmet.
Yeah.
Right enough. So fair enough. Thank you so much. Very relatable insights you have, and we can all relate to it.
Practical this thing. Even my elder brother had a problem. I took him for the vaccination. Right. After vaccination, he suffered for 15 days with the fever and body pain.
Oh,
15 days.
Okay.
Yeah. The very next day, I have taken the vaccine. Right. I have suffered only 3 days. 3 days, the fever was there, body pain was there. But after 15 days also, he was not recovering. So I took him to the hospital. I get the CT scan done and all. CT scan, it showed COVID, but not on the severity level. Not on the severity level. COVID was there, not on the severity level. Severity level means people what they are doing is that at home only they are taking all the precautions, medications, as I told you. Medications, because a lot of social media spread is that take paracetamol, take Dolo 650 and all this thing, control your temperature and all this thing. People, they keep on doing, but what is happening that they are not taking any antibiotics and all. Antibiotics now they are not taking. So what they are leading towards the severity of the COVID. Once fever start, if it is for 4 to 5 days, the 6th day you have to get referred to the hospital straight away. 5 days is the maximum. 5 days is the maximum at home for the treatment. 6th day you have to go for the hospital checkup. Right. CT scan, we don't advise much CT scan, because CT scan also leading very challenges to the other organs and all. CT scan, because regular imaging, regular radiations and all, it can lead to cancer also. Right. And by default, if you go for CT scan, nowadays CT scan is showing, HRCT is showing that you have a COVID by default. By default, because is that the lungs will always be a little bit infected for a common person also. By default, it will be infected. So if you think on that part, CT scan will give you that report only. RT-PCR is the best test, both nasal and the throat swab, so that you get the clear result. Rapid test also, I don't advise rapid test. Rapid test will give negative also if it is a positive.
Oh, okay.
Rapid test, right.
I wasn't aware of it, yeah.
Yeah. So I'm just sharing with you. Rapid test, what they do, the nasal swab test now, while they put the swab stick into your nose, what you will do, you will go back. Right. So whatever the swab they are getting, with that, if they dip in the chemical, it will show negative only. Got my point?
Oh.
So In rapid, this is what happening. If you are taking a rapid test also, make sure that if anyone is taking rapid test also with the government and all, you give a proper test for the nostril, the nose swab. So then only the result will come clearly. I've seen when I got tested for COVID, lot many people got positive, lot many people got negative. Right. Now here we talk about people going for tests. Everyone is open. Positive is also open over there, negative is also open over there. So spread of virus will be there also.
Yes.
So we have to be very strict for ourselves, for our family. The moment you come from outside to home, straight away go to the washroom, wash your hand, mouth, face, everything and all with the soap. Use any kind of Dettol or all this thing where it can get infected and all. Right, the infected virus can move on, germs and all can move. So that way you have to do and take it forward. So that is what.
Thank you so much, Dr. Rahman. That was very informative. A few of the things that I was also not aware, and that was indeed very insightful. Thank you so much. You indeed added a value to this session. Something that we were not.
Do wear helmet.
Yes, of course, the helmet example. I'm going to use it now. From now onwards.
Why I have used the helmet example, I am telling you. I am the founder of our National Road Accident Prevention Organization.
Oh, okay. No, fantastic example. I'm going to use it to my acquaintances and my friends. So who say that, oh, vaccine will not prevent it that much. Hona hai to hona hi hai. But no, now I will give that example. Thank you so much. In the interest of time, I move on to our next speaker. She is Dr. Jayashree Kadambi. She is a special educator at USA. Dr. Kadambi, we would love to hear about yourself and also about your views on our today's topic, helping the helpless and needy, India's war against COVID-19. Over to you, please.
Thank you so much, Deepa. It's been wonderful anchoring from your end. Moderating is great. Thank you, Dr. Rajarao, for initiating this wonderful session every day. I mean, I've been a part of the previous session also. It's been great. I'm sorry for the earlier glitches that was there initially. I apologize for that. I'm Jayashree. I work as a special educator in Chennai, India. Right now, I'm residing in US. I'm in New Jersey now, right now. I deal with children with special needs like learning difficulties, dyslexia, Down syndrome, autism, etc. So this is a wonderful topic, and I think a need of the hour, helping the helpless and needy during the COVID, right? So let me begin with a story. I mean, the story is a very common story, which all of us have heard during our childhood. You know, there is this tiger and that boy story, if you all recollect, right? There was a boy, young boy, very playful. He was in a village. Okay. So this boy, every day, you know, he was very playful and very mischievous also. So he used to play pranks on people, and that's the way he had fun, you know. So one day he thought of a great prank, thinking that, okay, let me fool around all the villagers. And he just went by, into the woods and the lake. And there was a beautiful lake and woods in that village. So he went there and, he just suddenly thought of, okay, let me tell everybody, the villagers, that there is a tiger in the village. Okay. So after he played, he used to come into the village and he used to just spread that, there was a tiger in the village, save me, save me, save me. So suddenly the people rushed into that place and they saw, then they said, oh my God, there is nothing here. What is this? Then they didn't take it too seriously. The same thing, the next day also he repeated. So second time also he repeated. The same thing happened. The people went there. They said, where is the tiger? Where is the tiger? Okay, now the third time, okay, he was having fun because this was just a fun for him, right? So he didn't relate what is the real consequence that's going to happen. So the third time, Also, he tried to play the same thing. He said, oh my God, there's a tiger, save me, save me, save me. But unfortunately, the third time, what happened? Do you think the people came and saved him? This time, the tiger had really stuck him. This is the truth. Today, in this world of pandemic, this is what we are facing. Last year, when the pandemic started, right? We all said, okay, save ourselves, save ourselves. We had strict lockdown. I think in the March 25th or something, the total lockdown was announced in the entire nation last year, right? If I'm not wrong. So then all of us were very strict, very disciplined enough in staying at home. And, most of us took care that, okay, there are elders at home, everything is going on well and things like that. But the moment the government said that, okay, we're going to have 50% relaxation, then they gave 100% relaxation. What happened to that same human brain? Why is it acting like that boy who was trying to say, save me, but now there is who can save you now, right? It is just like that story. Don't you think so? Deepa, do you agree with me on this?
Agree. Absolutely.
Yeah.
Wonderful.
So the thing is, now who's going to save? There is that human brain. We all were the same humans who were very careful about each other and respecting. We did respect. The government took wonderful initiatives and we followed that. But even when they said relaxation, we should have remembered that the pandemic is still there. It's not gone. The relaxation is given only by the government. It is not the humans that should relax. Where did we follow the norms? Where did we follow the social distancing? Where did we follow the, the masking up and things like that? People were so relaxed, So, and especially here, being an educationalist, I would say children, they have been affected a lot. I'm a teacher. So, children have been affected. We are saying take care of the elders. But what about the children? See, children are neither here nor there. The carriers are the mid-age people, between the 20s and 40s, right? These are the most vulnerable people who actually are getting frustrated, staying at home. Yesterday, I got a news that one of my student has been tested positive. So he's in 18 years old. So, but these are the children. Now, after this 1 year of that lockdown and things like that, the mental stress has increased a lot. So how do we keep all these things calm? It is very important that we educate our children because, we cannot ask a 1-year-old to wear a mask. They don't even know what the world is, right? So, especially when you talk about a newborn or a 1-year-old, they imitate the elders, right? So when we stay at home, when we are safe, they see that, okay, there is something going on. At least you cannot explain and make them understand. That is period, you cannot. So only thing is our actions speak more than words here. So we have to act wisely as an adult. So taking care of the elders, as Dr. Rahman beautifully said, the helmet example. And see, the many of us, most of us assume that vaccine is medication. No, I'm sorry. Vaccine is only a protection. Any vaccine for that matter. When we say diphtheria vaccine or meningitis, so many things, we vaccinate the kids, right? At every stage. Why do we vaccinate? It is not that a child who's vaccinated with chickenpox will not get chickenpox in the future. It is that severity will be avoided, right? That it will just be there for a few days and it will be, you can recover fast. That is the idea, right? But here, most of them have misunderstood the concept of vaccination. The vaccination is not a medicine. It is not a cure. It is only a protection. It is like that helmet, what Dr. Rahman said, right? So wear that helmet. But after wearing that helmet, what is the next precaution you use? I'm a cyclist also. I'm a marathon runner also. So what is the precaution you use even as a cyclist, right? You actually, wear the helmet to protect yourself in a better way so that injury cannot lead to the severity, right? So here we are protecting our children also in a similar way. Teach them, and also involve them in a lot of, home activities or even physical activities at home, like, giving them some basic yoga classes and, training them on some very simple fitness and things like that, which will keep them calm. Because children, they need to keep themselves busy. Otherwise, their mental stress will increase. Right now, as many of you have already beautifully said, the panic is there. It is all the severity. Why that severity? The severity, it reaches the severity level because of the panic, the fear from within. So how do you overcome this fear? This fear can be overcome as long as we are keeping our mental health very stable, right? So what are the ways in which we can help these issues? One thing is, we can engage ourselves every day in at least 30 minutes of some kind of walk on the terrace or walk in your flat. Right now, I would say going out and coming is it's not advisable that much. But at the same time, vitamin D is very essential, right? So we have to take that vitamin D in order to keep ourselves very sane. That's what I would say. So engage your children in some kind of, or connect them with some yoga trainer or somebody who can engage them at least for 30 minutes. Because in this online situation, children cannot concentrate more than 30 minutes. So don't overdo that. Just go ahead. And also, there are so many, in general, there are so many organizations. I'm also a part of Rotary. I'm a Rotarian. So you can reach me as well. We are doing a lot of, COVID relief, services towards the community by giving, on May 10th, I'm actually going to do the Annadanam for those residing on the platform. So, I'm planning to do for 200 people on that day, on May 10th. So, please reach out to me for any kind of service. I'm always there to, help you all here. And, in case of any kind of help for the children, if anybody needs to take any small fitness classes or any kind of breathing exercises, all these things, I'm always there to help you all. If you have any child in your house who needs that kind of motivation or some kind of trigger that can help them in keeping them busy every day, as an educationist, I can definitely pitch in. Please do feel free to contact me anytime on this. I'm there to help you. And I will also reach out to my fellow Rotarians who can, if you all need any medical help, our people are always there on ground level to serve the nation during this crisis. And, also many of them, especially I'm from Chennai, right? So many people think that, it is very hot, we can always go out, the sun will kill the virus. No, it's not going to kill the virus. That is a foolish thing to believe. So please don't, be in that myth that sunlight will kill the virus. No, it is the social distancing and masking up. As, Professor Regunath already said, double mask. Yes. So double mask it is of course very suffocating to wear a mask itself, but only during crowded places you should wear. And today, actually, funny thing is, in one of the groups, some WhatsApp group, I read a big message. This message was from a doctor in Maryland, USA. Okay, those points that he had mentioned is pertaining to USA. But what our Indians will do, it says in one of the points, it says it is clean air. You can walk into the parks and all the public places. But unfortunately in India, it is not a clean air. So where that brain of our people will not correlate to that, right? We should always think that that doctor is from US. So he will relate to US only. He's not going to relate to the Indian population, right? So we all should have use our common sense to save our people. And most of the things that what I get from even Dr. Rahman beautifully said, right? It is all because of the fear within that we spread, And one more thing is, media also sometimes projects things unwantedly. So it is very unfortunate that sometimes they do give false news or some old news that has been, they keep repeating that same thing, what has happened. I also, urge the media to project good things that are happening, show the recovery cases that are happening, so that the elderly and the children will come out of that fear, right? So that they will have some trust on the people who are working. See, it is not just the government, but there are so many NGOs and other organizations working really hard, right? So what happens is, because of all this false media on the social media or the internet, these hardworking things gets nullified. So what about those millions of people? Even day before yesterday, I was watching something on the thing that people are putting their own money to bring out this, get the pandemic to normalcy, right? So there are many organizations, many individuals who have converted their clinics into COVID relief places, right? So in that case, we have to support each other and respect each and every individual. The third wave, we don't know what it is going to be, but let us not think about the third wave. Let us see what is the current situation. Let us see what we can do at this point. Let us not worry too much about the future. Past is past, yes, but we can say what is going on right now. Control your presence outside as much as possible. Only the people who are working on ground, real workers, should go there. Not everybody should crowd and make it more worse for the others, right? So
agree, Dr. Jayashree. I totally agree with you. Of course, in these uncertain times, and masking and social distancing and unnecessarily travel and presence everywhere, we are just safe at our home, and this is what we should consider very seriously. Also, thank you so much that you extended your helping hand for any calls or reachability to you for any of the help required over a call, or any of the fitness sessions, or anxiety help, special kids if they need any help. I can request if you can share your contact details in the chat box, or your LinkedIn profile. I'll also share my LinkedIn profile very soon, and there all of us can stay connected. Thank you so much. It was very informative and insightful indeed. Thank you so much.
Thank you so much,
Dr. Kadambi.
Yeah, thank you so much once again to World Peace Commission and Dr. Raja Rao for this wonderful opportunity. I have shared my number on the screen chat box, so please note it down.
Yeah, thank you so much. Moving on to our next speaker. She is Dr. Rajalaxmi Ellen. She is CEO, Millionaire Fly Emi Academy. So may I invite her to share about herself and her views on our today's theme, helping the helpless and needy, India's war against COVID-19. Over to you, Dr. Rajalaxmi Ellen.
Hi there. Thank you so much. Thank you so much for the great introduction. Her Excellency Deepa Madam, you can hear me? Can you hear me?
Yes, please. You are audible, visible, both ways.
Thank you. Thank you so much. Good morning to you, good afternoon to you, good evening to you, wherever you are in the part of the world. I'm so happy and grateful that we are actually here being addressing to help India in this very stressful situation where the whole world is actually facing a lot of challenges. Now, let me thank Dr. Raja Rao. Thank you so much for this great opportunity, and thank you to all Her Excellency for giving me this opportunity. And I do apologize if there was a delay, that the time difference that I have, I was actually having time difference, so that is why I have to enter this a bit the delay. Thank you so much, Dr. Raja Rao, for contacting me. Addressing this issue here, we go through life never getting in touch with our greatness, just because of the lack of motivation to push ourselves until something life-threatening situation comes to us. Just like how if we are swimming in a river and all of a sudden we feel there is like a sudden current below us that is actually like trying to pull us down. What is the first thing that we will do is that we don't think about somebody, or we don't think about who is going to come and help us. What we do is that we become the help for ourselves. We have this inner power inside of us, each and every one of us. Each and every one of us were born with greatness inside of us. So what happens is, as time passes by, that we depend on so much of the outer world, thinking that we are not powerful. You see, I would like to share my own personal experience just this time around last year, somewhere around June 2020, in spring. What happened was that there was a time that the lockdown was a new trend in the whole entire world. And I was actually like living in a city which is very new to me. And I didn't know many people around, and my families were not there. And most importantly, I was newlywed, and my husband, for some reason, he was not able to come back home. And adding on to this, that was the time that I was actually going through my first miscarriage for my first child. So it was actually a devastating kind of situation where I can't actually explain this. I can't express this by words. But what happens is, I was just waiting for days to pass by, hoping to heal physically, mentally, and emotionally. And this is actually the hardest part, I would say, of feeling helpless and feeling that you are actually like needing some help. So I understand that this pandemic is making a lot of more challenging situations for everyone in everywhere of the world. And this is also so painful to see what the world is actually going through, especially India now. And I would like to stress that this statement here, that when you are facing a tough time, remember that the tough time never lasts. It's the tough people that does last. So whatever you're going through now is just a temporary kind of a situation, but who you are becoming is much more important, because we are all born with greatness. Every one of us have got the greatness seeds inside of us. So this is what I believe, that when you are needing a help, and when you feel that you are needed, remember that you are a help for your own self. Because I always being a student of Tony Robbins. Tony Robbins is actually an American author, speaker, and he's also a philanthropist. And he always speaks about the aha moment in your lives, and the stories that you tell behind every situation that happens to you in your life. If you see things are impossible for you got to stop for a moment and turn around and look at yourself and realize that inside the word impossible, there is a word, I am possible. However the situation is in your life, you think it's impossible. But if you just take one moment, turn around and look at it, you will be able to realize that you are possible to do anything that you want to, despite the situation, despite where you are. You are with me there, Deepa? Madam Deepa?
I am absolutely there with you, and I totally agree with you that despite of difficult situations, we should not lose hope. And when we look back, we are always, it prepares us to be much stronger. And I have personally felt that, and I totally agree to it.
Thank you so much. So looking forward to see where we can actually seek help. There's another thing that I would like to stress on this, because as I believe that every one of us have greatness and we have a purpose. The reason why everyone is born in this world, we have a purpose, and we have got there's something that we are born to do. There is a purpose for us. So if we see within ourselves and we find out what are the purpose that we are here for, there will be a great reason for us to move on in our future, despite what is going on in this life. Struggles will come no matter what, even this pandemic or even whatever we're going to go through in the future, struggles will be there. I would like to just share a quick story about my life experience, where this actually happened just few years before the pandemic. I think about 2 years just before the pandemic. And I would say that I personally was in a situation, I would address myself that I was actually in a situation where I was needing help, and I was considered that I was helpless because there was not much resources. The reason is because I just moved back from Europe. I was living in Europe, and I just moved back from Europe to back to my country. And that was the time that I had to stay in a temporary accommodation. And I think that whoever has got pets in their life, I think they will be able to relate a little bit of what I'm trying to say here. Because when you are having, I'm a person that I love animals, okay? So I've been having lots of pets in my house, and the last one that I had was a little tiny dog, Shih Tzu. She was called a Genie girl. She was actually going through a very hard time of her life during towards the end of her life, where she had a tumor that she had to remove. She had to go through a medical operation that she had to remove the tumor. And I, being the owner, I was actually in, long story short, times were very bad for me. Times were very bad for me in the sense that I myself, I was not able to take care of myself. And I had another life that is not able to voice out her pain and her hurt. So I made a point in my life that no matter what happens, I'm going to save her. No matter what happens, she got to be safe. So you see, the situation was such like, I was not even able to go out because I didn't have my own car. I sold off everything. And the only thing that I had was that my mind saved her. You see, I was in a situation where I was even living in a house where the internet connection, even if I want to fill up a form, the internet just goes off halfway. So you just see, in that kind of situation, what happened to me was every single day, I train my mind. I tell myself, no matter what, this little one is going to be safe. Out of nowhere, it's just like a light at the end of a tunnel. Life just changed. Out of nowhere, life just completely changed from where I was living in a temporary accommodation. I moved to an apartment just with my little, that little pop, to a beautiful apartment with 3 bedrooms, just 2 of us facing the swimming pool. And from a point that I am not able to take care of myself, I invited my dad to the city that I was leaving, and I was able to take him to a restaurant where he was actually enjoying the food, but in my heart, in my eyes, I almost had tears looking at him. The reason is because I was like from zero, I managed to come up by myself, being able to invite him to a restaurant, to be able to, give him that luxurious kind of a dinner, where I didn't have anything when I was just few months back where I came from. And also from telling you my situation about what happened to that little life that I had, she had gone through a beautiful operation from a specialist, and she survived her life longer than what they expected. That was a feeling that I actually, wanted to feel, to see her smile on her face, from where I couldn't do anything. I was just helpless. I didn't know what is going to happen to my life and how am I going to save her. But I told myself, I trained myself, there is something inside of you that you will be able to do what you want. So no matter what situation that you are going through, I'm just giving you my example. You can actually put it in your life. In whatever situation that you are going through, there is something that will push you to go to where you want to be, to live the life that you want to be. No matter what situation you're going through, it doesn't matter if it's the pandemic or what is going to come in the future. It doesn't matter how your life is going to go on. But as long as you have the belief and trust in yourself, it will take you to the top and it will take you to where you want to be. So just keep faith in yourself and have belief in yourself that things will change for you only if you believe that it will change. So this is something that I would like to stress about, know what actually happened in my life. And helping the helpless and the needy is a great blessing. They may not have the money to repay us back. They may not be able to offer the equal returns of the service that we offer, but the inner peace which they may get in their spirit for that little moment shall be a bliss of our lifetime blessings to our body and our spirit. So this is my sharing for today.
Dr. Ellen, I totally agree to that. Good deeds never go in vain. Of course, even if those unconditional acts of kindness I'm sure sometimes you realize that I will not get anything in return, and that's the reason they are called unconditional. And but somehow the universe is such, and I totally believe in it. There is some power there that good deeds never go in vain. They never are wasted. They will come back to you in disguise of a blessing to you. And you sometimes, at times when you are hopeless and need it the most, something like a magic will come up, and the return of your good deeds will surely come back to you. And I have experienced it. I have uh, experienced it in my bad days. Of course, everyone has it, and we are all humans. I totally agree to you. And I see a thumbs up from Bhavna Chibar ma'am. Thank you so much for resonating the same. It was indeed very relatable with your life experience that you have shared, of course, and it very is very much relatable to our theme, uh, helping the helpless in times of need. Thank you so much. Coming to our next
Thank you so much,
speaker.
Your Excellency, everybody. Thank you.
Thank you so much. Coming to our next speaker, she is from Brunei. She is Miss Farhana Haque. She is a PhD research fellow. And let's hear it from her about herself and about for our topic this evening, helping the helpless in the times of pandemic, India's war against COVID-19. Over to you, please. Meanwhile, you keep speaking. We're all ears to you. May I request everyone to go on mute other than the speaker, please? I could see Professor Mike Omosin. He is unmuted. So please, can you go on mute, please?
So I think it's okay now.
Yes, please. We can manage with this also. Please continue. We can see your slide number 1.
Let me just, sorry. Yeah. Okay. So as I told that about today's topic is helping the helpless and needy, India's war against COVID-19, and I chosen the topic about protecting unguarded children from the impact of coronavirus. So this is the topic of me which I want to talk about. So how coronavirus now becoming a challenge to the whole world. So what is the challenge? So we can say that this pandemic situation, in this situation, people are alive, but we can see them. They are literally invisible inside of home, and worldwide it's happening. And this outbreak is claiming lives and livelihoods as health systems buckle. Education is disrupted and families struggle to stay afloat, and communities across the globe are rising to the challenge from health and social workers risking their lives to protect the most vulnerable to young people, deploying innovative ways to share public health progresses and messages. Yet, even as the spread of the virus shows in some countries, its social toll has come fast and hard, and in many places, it comes at the expense of the most marginalized children. So, in my country of origin, like India, in Bangladesh also the situation is not good, but in Brunei it's like heaven. It's like normal, like we are doing everything as like we used to do. So we don't know about the COVID situation, the horrible thing which is going on in Bangladesh, India, Pakistan, and also in Europe, US. But I don't know how the government of Brunei, they managed the situation very good way. It's like a home, like we are living in a drawing room, like it's very safe in Brunei. We are doing everything very normally, but not outside people are not doing like that. Even in Malaysia, it's very risky. They didn't open the border. It's still closed in Malaysia. So without next, I would like to talk about that. Without urgent action, this health crisis risk becoming a child crisis, rights crisis. So it will be, if it's time that we need to take actions, that we have to save the children's future. Because I know I have a little daughter, she is 6 years old. So if I am now in Bangladesh, she will be, able to stop her study and everything. But in Brunei, people are studying. Children
Madam,
can
Farhana
study.
ma'am, please. Farhana ma'am, our guest is
Yeah.
waiting. Please allow her. Now you are the
Yes.
admin. Please allow our guest is waiting. You see your screen, please.
Which screen?
One guest from England.
Yeah.
As you are
I don't
the host now, please can you enter her?
Me are the host.
Now you are the host. One of our guests is waiting in waiting room.
Okay. Okay,
Can
I have
you-
to admit.
Yes, you have to
Admit.
admit her. Yes, yes. Can you see the
Okay.
screen?
Screen of whom?
Can you
Yeah, I
please
can see.
take the rights back from her? Quickly do that and return the rights to her. I think
Did
somebody
I
has
add-
just joined.
Yes.
I think I clicked the button of admit.
Yes, ma'am.
Fantastic.
Yes,
I saw someone, Advocate Obalola. He just joined. Yes,
Is
please.
it okay now?
Yes, please. Absolutely fine. Please proceed.
Okay. So yeah, this is the thing. And according to UNICEF, they took some global actions to save the children worldwide. So what are the actions? We can say and mention those actions like keep
Madam,
children
sorry to
healthy
disturb
and
you.
well. Yeah.
Guest, her name is Dr. Parin. Parin is waiting in bed.
To scale up rapid assessment, develop urgent mitigating strategies, and prepare interventions to respond to the COVID-19 crisis. So they are working on it. So we should now we should think that we should not let children be the hidden victims of COVID-19 pandemic. We should think about children now more than anyone. So we should think about it, that in this crisis, the
Dr.
young
Farhana, I would regret
Yeah.
to interrupt you. I'm so sorry about it.
Yeah.
In the interest of time, and I truly
Yes.
understand your empathy towards the children being the victims of the COVID-19 pandemic,
Yes.
and your concern that we are again and again talking about elderly and the young generation to be saved from COVID-19.
Mhm.
However, nobody talks about the kids, considering, or maybe it's an assumption that we
Yes.
think that they are already equipped with immunity and antibodies, and they would
Mhm.
not get affected. But I have
Yes.
experience, and I would like to share that in my acquaintance, in my office only, I got to know that the husband, wife, and also the 7-year-old all got infected. Okay. So
Oh,
even nowadays,
okay.
we are hearing a lot of cases where kids are not spared. And ever since that news has come out, it has spread like fire. And we know that kids are not being, are not an exception this time, the second wave. And the third
Yes.
time it's going to be worse.
True.
As Dr. Shafiur Rahman said, that that will be affecting the 18 and lesser than that. Yeah,
Less than
I
that.
totally
Yeah.
agree to your point, and I can resonate with that. In the interest of time, we just have one
Yeah.
special guest for this evening. So I would request
Sure.
you to please wrap up in another 2 minutes,
Yeah,
please.
it's the last slide. This is the last slide. That's the conclusion. So this is the
Okay.
conclusion that we should think about kids and children and below 7 years old kids, and we have to think about them. And while we are currently focused during this long lockdown period on the immediate concern of keeping ourselves and our loved one healthy, we must also remember the millions of children who risk becoming the forgotten victims of this pandemic. What their world looks like tomorrow and what their future ultimately look like is also a responsibility today. So this is the thing I would like to say. So thank you everyone for hearing me. Thank you.
Thank you so much, Dr. Farhana. It was very insightful, and we totally appreciate your concern for the children, the migrant kids, and how they have been neglected, ignored,
Yes.
and are not a topic of concern for our current today talks and concern about
Yes.
protection against
Protection.
COVID-19.
COVID-19. Sure.
Exactly. Yes.
Thank you,
Thank
ma'am.
you so
Thank
much.
you.
Thank you
Thank
so
you
much
so
for your
much.
presence. And we truly appreciate that you joined us here today.
Thank you, ma'am.
For coming to our next speaker, we have a very special guest, Dr. Parveen Somani from United Kingdom, UK. May I invite him to get his video on so that we can have him visible as well. Dr. Parin Somani, are you there? Can we hear you and see you as well? Welcome, Dr. Parin Somani. So can you please check with him if he is there? Dr. Parin Somani is our last but not the least speaker for this evening session. And after hearing from him, I would like Dr. Raja Rao to give a vote of thanks, and then we'll be concluding this evening session. We could see you, Dr. Parin Somani. Hello, we are humbled and honored to receive you on our today's session, and we are glad that you could take out your precious time to be here with us. We would definitely would love to hear about you and your views on our today's session for this evening, helping the helpless and the needy, India's war against COVID-19. Over to you, please. Welcome, Parin Somani.
First of all, I would like to say a very big thank you to Mr. Raja Rao for inviting me here today. It was my great pleasure to be with you all. My main concern is that right now in this COVID pandemic, a lot of things we are facing. Let me introduce myself. First of all, I did not even say that. My name is Dr. Parin Somani. I'm an international academic scholar, motivational speaker, writer, author, philanthropist. And I'm involved with many organizations. I have got 5 doctorates and 4 world achievers. I work with on a global level with many universities around the world, with academics and many NGOs as well. In this pandemic, I only have to say that we have to be very positive, be happy, and make sure you help each other. We won't be getting the same world which was there before. Yes, but if we can work together, if we can help each other, and if we can be on a one voice, yes, we can do things which people are facing. Right now, I'm in Delhi. And I know the situation in Delhi is extremely bad. When I think of it, I am emotional. I get very worried, and I think, oh gosh, what's happening in this world? What's happening in our own country? But yes, by working together, we can make a positive global change. Thank you and namaste.
Thank you so much, Dr. Somani. That was very crisp, and you had a very happy and positive entry as well, I must say. You made us smile, and we were happy to see you. When you say you feel that anxiety and sadness during these times. We have Dr. Jayashree Kadambi, who extended a helping hand to talk about positivity and such anxiety times. She has already shared her number and she will again share it. And she's there mentioned already that we can always call her. She's just a call away to talk and yes, Dr. Kadambi, you can say that again to Dr. Somani so that she
Yes,
gets an assurance.
Definitely. You can reach out to me anytime. Any child, anybody, any adult in need of help, they can reach out to me. Even for any medical assistance, all the fellow Rotarians are all over the world. They're on ground level. So, I can just reach out to them and give you the needed information or help. Genuine, because, many of our Dr. Rahman already beautifully said that people have been forwarding unwanted messages, right? So, so let us all stop that. Let us not, just because we have some information and just because we have to pass on something, please let us not forward any message. I don't welcome any forwarded message. I neither forward any message unless I verify it myself.
Absolutely.
So, being a Rotarian, I think it is my responsibility to verify it first because it is going to save a life.
Absolutely.
And in terms of mental health, I'm always there to give the fitness assistance to children, any child that is in need of help. So please reach out to me. I can always be there. Thank you, Deepa, again for the, mention.
Thank you so much. Thank you so much, all of you. And as she rightly said, that verifying those numbers is the minimum of help that we can do from our end sitting at home, because that is indeed also a need of the hour, and that is also a helping hand for the helpless and the needy, because nowadays we see a lot of people asking for plasma, oxygen cylinders, ICU beds, ventilators, any help. At least the minimum we can do is verify those numbers before forwarding. So that is one basic help that we all can do rather than simply forwarding and creating confusion and a chaos. So I then hand over to Dr. Rajarao for a vote of thanks and his views on today's session, please. Over
Deepa
to you,
Chowdary,
sir.
ma'am. If there is a man of the match and a man of the series award is there in this webinar, certainly that will go to Deepa ma'am. I will give you a big round of applause for her, what we call performance or the way she is speaking. Really, you are excellent, ma'am. Today you have added some flavor to the program. Really amazing session by Deepa Chowdary, ma'am. Really, we are honored to have your presence. I would like to invite Carolyn ma'am to say a few words about our special guest, Somani ma'am. Carolyn ma'am, please, 1 minute only, please.
Good evening, Excellencies. Good evening, very beautiful ladies and eminent speakers. I'm very happy to see you all, especially a warm welcome, ma'am. The new guest today, the eminent speaker. I'm very happy to see you, ma'am. Sorry, I forgot your exact name. Parani?
Pareen. Pari. Asman ki
Pari is nice, ma'am. Angel. Excellent. That's fine, ma'am. So very happy to see you, ma'am. Really, I'm really happy. Feeling very pleasure to see you and meet you on Zoom. A warm welcome, ma'am. Thank you very much.
Thank you.
Thank you. Now I would like to say a vote of thanks to our guests. First of all, we start with Jayashree Kadambi, ma'am, all-rounder. She is there everywhere, even in sports, in teaching, for the people, those who are in needy and helpless. Ma'am, Jayashree, ma'am, a big salute to you, because you are the real all-rounder. You have to go on a long way. You will reach many milestones. Excellent, ma'am. We'll thank you so much for your presentation. And Shafiur Rahman, sir, he's basically a doctor and an international person. Actually, he hasn't yet completed his speech. Rest of the speech will be delivered in tomorrow's session. Thank you so much, sir, because he's very a busy person. Even in his busy schedule, he spared time and he has given his presentation with real life examples to inject in the minds of everyone. Thank you so much, sir, for giving your precious time at this juncture in the COVID pandemic. And you are being a busy doctor, you have allotted your time and enlightened us. Thank you so much for that, sir. And I would like to thank one more Rajalaxmi, Alan, ma'am. Really, you are so touching today. Actually, you are not like that. You are different, but today you seem to be entirely different. An Indian woman, 100% Indian woman. You have touched everyone's hearts, ma'am. Thank you so much.
You so much, sir.
We have seen the different side of Emi Alan Rajalaxmi, ma'am. Thank you so much. It's a really splendid presentation,
so
ma'am.
much,
Thank
sir.
you. Then I would like to thank Farhana Haque, ma'am. Sorry, ma'am. We say sorry. We have disturbed you. But you are excellent, ma'am.
It's okay. Thank you. Thank you.
Thank you so much. We have to say thanks to your kid also. Your daughter is there here and there roaming, disturbing. But you being a true mother, you have great. And we also thank Professor Regunath Parakkal. He's also delivered an excellent presentation. And finally, we conclude this program saying big thanks to Deepa Chowdary, ma'am, because we have to give her a round of applause. It is not possible, but just put your hands together to say thanks to Deepa Chowdary, ma'am, for adding colors to this program. Thank you.
Thank you so much. Thank you so much. I'm humbled and honored. Thank you so much.
Thank you. Sir Shafiur Rahman, sir, will you share 1 minute? Shafiur
Yes,
Rahman,
sir. Yeah,
will you
Dr.
please,
Rajan.
will you please continue with 1 minute? Or if it takes
Yeah,
much time?
Yeah, sure. Thanks for giving the opportunity. I'm audible?
Yes, sir.
Yeah, I was trying to give the insights of the government, of Indian government. The exact statistic figure where we are standing in India. See, India has 139 crores of population. Right. And being the citizen of India, it's a government responsibility to take care of the citizens. Right. Whereas the health is concerned. So coming to that, where we have 139 crores of population, we have hardly 95,000 ICU beds in India. That is government and private hospital, 95,000 beds. And if you see the figure of COVID positive cases, it has gone into lakhs. It means it's very clear that all are not been given that kind of support where they can get the treated. And coming to the ventilators, what we have, it's almost all 98,000 approximately, including private and the government, 98,000 ventilators. So it's a very pathetic situation. Now the government has time to take action on this part. Because as it is, government has itself announced that the third wave will hit October. The third wave will hit India, right? And when the third wave will hit, there will be number of cases which will increase. And if we are not ready with the infrastructure and all, it will be a very horrible situation. Like we have seen when Ebola hit Africa, people were dying on the road. Because there was no medication, there was no hospitalization. People were dying on the road. So we pray to God that that situation never come in India. But yes, we have to get prepared for this. Because even if you overall see the hospitals we have in India, it is 89,000 hospitals. Private and government, including the private and government, it is 89,000 hospitals. And total 7,39,000 beds are there. That's all. That is what, if government, I hope that the government come into action and we have been safe, because we can't leave India also because of pandemic, lockdown and all. We can't leave India also. So We have to be here, we have to face everything and all, but to face also, we should have support. Unless and until we have the support of government, it's quite difficult to survive also. It's for sure. Right. Thank you very much, Dr. Rajarao.
Thank you, sir. Thank you so much. The program is officially ended. And once again, I thank each and everyone, all the guests. Thank you so much for your valuable presence. Thank you.
Thank you so much. With this, we conclude today's session. Thank you so much. Stay at home and stay safe.